The Ministry of Health of the Gambia is intensifying its effort to combat neglected tropical diseases within the country. As part of this initiative, the ministry, in collaboration with its partners, organized a day-long orientation session on Monday for the members of the National Assembly's Select Committee on Health and other Assembly members. This session highlighted the Gambia's progress and challenges in addressing NTDs. The meeting emphasized the importance of the African Leaders Malaria Alliance scorecard as a key tool for tracking progress towards NTD control and elimination. This scorecard is designed to monitor and accelerate advancement in this area. The engagement also underscores the essential role of National Assembly members in advocating for continued political and financial commitment to combat NTDs, supporting both national and global health objectives. Neglected tropical diseases affect the world's most impoverished regions where access to healthcare, sanitation and safe water is limited. Speaking at the event, Dr. Mamadou Tinyasi, Director of Health Services at the Ministry of Health, emphasized the critical role of National Assembly members in driving policies and accountability for sustainable health initiatives that can transform lives.
These diseases hinder progress, impact economic growth, and deepen the cycle of poverty, but they are preventable, treatable, and can even be eliminated with sustained and targeted actions. As representatives, your role is crucial in driving policy and accountability for sustainable health initiatives that can change lives. The African Leader Malaria Alliance scorecard for accountability and actions offer a framework through which we can track, measure, strengthen our response to NTDs.
The World Health Organization reports that neglected tropical diseases are predominantly found in tropical regions, impacting underserved communities and leading to severe health, social and economic repercussions. Honorable Amadou Kamara, Chairman of the National Assembly's Select Committee on Health, emphasized the significance of this issue and urged his colleagues to promote advocacy efforts within their respective constituencies.
And as members of the National Assembly, we are always open to such because our functions varies from being legislators only, and of course the representatives, but also advocacy is key as far as our functions are concerned. So it is not a mistake that we are invited to partake in this very important gathering. Because if you look at the topic that we are looking at in hand is basically talking about NTDs, that is neglected tropical diseases. And these are diseases that affects people, especially people in the poorest regions, which include my very own constituency, because if you go to statistics and of course indicators, the region, and if even the constituency where I come from is ranked among the poorest as far as indicators are concerned. And these are diseases, these are conditions that affect these people most because of lack of adequate access to water and of course sanitation. But we are moving. I can assure you that we are moving with the current government. We are moving.
The WHO also notes that the African region accounts for nearly 40% of the global burden of neglected tropical diseases. A representative from the African Leaders Malaria Alliance stressed that tackling neglected tropical diseases is crucial to their mission of achieving universal health coverage and advancing the Sustainable Development Goals.
Today, we gather not just as individuals, but as collective force committed for making a meaningful impact in our communities and beyond. Advocacy is more than a skill. It is a vital component of social change. And each of us here today represent a unique voice, a critical perspective, and unwavering commitment to the issues that matter most, the neglected tropical diseases. These diseases, often overlooked and underfunded, affect over 1 billion people worldwide, many of whom are among the vulnerable communities. As leaders, we have a profound responsibility to advocate for the health and well-being of our communities, and we have a homework to fight these diseases of poverty and inequalities.
During their presentation, officials from the Ministry of Health shared some of their accomplishments in combating neglected tropical diseases in the country. They also outlined their expectations from the National Assembly members, which include robust advocacy for neglected tropical diseases to support the 2021 to 2030 roadmap, the implementation of the 2023 to 2027 master plan, and the incorporation of the neglected tropical diseases in the national budget. Reporting for Kirfatu, I am Ramatulai Jao.